Good morning, students. Today we are going to see Unit 21, Health and Disease. Last video we saw the same unit in the types of abuses, child abuse, sexual abuse, child sexual abuse, approaches for protection and an abused child, prevention of child sexual abuse. In this video, we are going to see drug abuse, types of drugs, drug dependence, behavioral changes of drug users, drug de-addiction, tobacco abuse, tobacco use, smoking hazards and effect of tobacco, prevention of smoking. Let's see one by one in detail. Drug abuse. First, drug abuse. Drugs are normally used for the treatment of disease. If a person have any disease, stomach pain or headache or fever like that, some disease, the person used treatment from the recovery of the disease. The doctor advised to use these medicines, some medicine, any medicine. Withdrawn after recovery. Withdrawn means stop after the recovery. But the person who habituated to drug due to the prolonged use the same drug, that is called drug addict. This is called drug addiction or drug abuse. The physician given the tablet for the treatment of some disease, but the person used the same tablet prolonged, that is drug addiction or drug abuse. A drug that modifies the physical, biological, psychological or social behavior of a person by stimulating, depressing, disturbing the functions of the body and the mind is called addictive drug. The person, if addicted to the same drug, the person cannot behave normally without the drug. That is called addictive drug. The person is taking the same drug prolonged, continuously, without the permission of physician, doctor, without the permission of doctor. These drugs interact with the central nervous system and affect the individual physically and mentally. That is drug abuse. Types of drugs. Types of drugs. There are certain drugs are called psychotropic drug, which act on the brain. Alter the behavior, consciousness, power of thinking and perception. They are referred as mood alerting drugs. Then for psychotropic drug is affecting the brain, behavior, consciousness, power of thinking and perception. They are referred as the mood alerting drug. Mood alerting drug means the alert the mood, thinking. Drug dependence. A person who consumes the psychotropic drug, a person fully dependent on them. They cannot live without the psychotropic drug. This condition is referred as a drug dependence. The person depends the drug for survival. This is two types. One is physical and mental dependence. The person normal condition of well-being and to maintain physiological state with the help of psychotropic drug. The person with the psychotropic drug only look normal condition and well-being. Next is psychological dependence. Psychological means mental, feel. The person feel that drug help them to reduce stress. The person think, feel that drug only help them to reduce the stress. Next, International Drug Abuse Day on June 26. International Drug Abuse Day, June 26. Narcotic Drug and Psychotropic Drug Substances Act introduced in 1985. Behavioral changes of drug users. The person, he or she, using drug without the permission, without the knowledge of doctor in adolescent period, some changes will come. They are drop in academic performance, absence from school or college, lack of interest in personal hygiene. Personally, the person is not neat and tidy. Isolation, always be in lonely. Depression, mood is not good. Fatigue and aggressive behavior. Weight will increase. Aggressive behavior, the person behaving rudely with others. Deteriorating relationship with family and friends means differently behaving with the family members and friends. Changes in food and sleeping habit. The person is not taking food properly and sleeping is not proper time. Fluctuating in body weight and appetite. Fluctuating means changing. Weight will increase or they reduce, then and there. They are feeling hungry in different time. Always looking out for an easy way to get money for obtaining drug. Looking for money, easy way. Easy way means taking money from some other person without knowledge, like that they are getting money for obtaining drug. Prone to infection like AIDS and hepatitis B. Due to drug abuse, hepatitis B and AIDS disease will come. Maybe will come. Drug de-addiction. Drug de-addiction is a management that is complicated and difficult task. A person is recovery from the drug addict is very long process and slow process. This process taken by the family members, friends and society on the whole, they have a very important role to play. The drug addict come out from the addiction. This is a different way. First one, detoxification. That is, the person is continuously prolonged taking the medicine. That medicine in his or her body, blood. So, detoxification. First step is treatment is detoxification. The drug is stopped gradually, not sudden, gradually. And the addict is helped to overcome withdrawal the symptoms. The addict undergoes severe physical and emotional disturbance due to detoxification. This is taken care of by the specific medication, the help of doctor. Next, psychotherapy. Second step, psychotherapy. Individual and group counseling is given by the psychologist and counselors. The treatment include effort to reduce the addict stress, not new way to solve everyday's problem, adequate diet, rest and relaxation. This given by the psychologist or counselors. Next, counseling to family members. Those who are living with a drug addict, the family members or workplace, social and friends give counseling given by the psychologist, social worker, counselor, family members in order to change the attitude of rejection so that the addict is accepted by the family members and society. Next, rehabilitation. They are given proper vocational training. Rehabilitation means training so that they can lead a healthy life and become useful members of the society. They can lead a healthy life useful to the society and family members. Tobacco abuse. Tobacco abuse is obtained from the tobacco plant. Nicotina tobacum and Nicotina rustica is a scientific name. The dried cured leaves of its young branches of the plant make commercial tobacco used worldwide. Addiction to tobacco is due to nicotine and alkyne. The alkyne nicotine is present in the tobacco plant. This alkyne only stimulate the mood, feel. So the person is addiction. Nicotine is a stimulant, stimulate the mood. So it is highly harmful and poisonous substances. The person how to use the tobacco. Tobacco is used for smoking, chewing and snuffing. Inhaling tobacco smoke from the form of cigars, cigarettes, beedies, pipes, hookah is called smoking. Tobacco is a powder form is chewed with a pan or betel leaf is chewing. Third one, when the powder tobacco is taken through nose is called snuffing. Smoking hazards and effect of tobacco. Due to tobacco, some disease will come. First, benzopyrene, polycyclic hydrocarbons present in tobacco. Smoke, carcinogenic, cause lung cancer. Lung cancer will come due to using tobacco. Causes inflammation of throat. Throat is paining and bronchi leading to conditions like bronchitis and pulmonary tuberculosis. The bronchitis means in the respiratory tract some disease will come, that is bronchitis, and pulmonary tuberculosis will come. Inflammation of lung, alveoli, decrease the surface of area for exchange and cause emphysema. Inflammation of lung alveoli. Alveoli is a balloon-like structure inside the lungs. It is exchange the carbon dioxide and oxygen. The surface will reduce due to the smoking. Cause emphysema. Carbon monoxide of tobacco smoke binds to hemoglobin of RBC and decrease its oxygen carrying capacity, causing hypoxia in body tissues. The carbon monoxide of tobacco is bind with the high RBC. In the place RBC is taking oxygen, that place will reduce due to the carbon monoxide. The decrease oxygen carrying capacity, hypoxemia in the body tissue. Body tissue is not getting enough oxygen. Increased gastric secretion which leads to gastric and duodenal ulcer. The digestive tract, duodenal digestive tract, the ulcer will come. Tobacco chewing causes oral cancer. Oral cancer means mouth cancer will come. Due to tobacco chewing, mouth cancer will come. Prevention of smoking. Knowing the dangers of smoking and chewing tobacco, adolescents and the old people need to avoid this habit. With the help of proper counseling, medical assistance can give up the habit of smoking. World Health Organization WHO suggests to advertise in all advertisement of cigarette and packs carry smoking is injurious to health. The warning is printed in all the cigarette packets and advertisement that is suggested in 1984 by WHO. The Anti-Tobacco Act was passed on May 1st, 2004. Anti-Tobacco Act, May 1st, 2004. May 31st is observed as a No Tobacco Day. No Tobacco Day, May 31st. Anti-Tobacco Act was passed on May 1st. Thank you, children. Let's see the next abuse in the next video. Thank you.